Okay, well, welcome everyone to the 3:30 study session for the Jefferson County Board of Health. We're going to jump right in. And actually, I'm just going to turn it straight over. Oh, no, first we're going to do the language justice. We do have a person here today. Her name is B, and we're happy to have you, B. Thank you. She is going to do the language justice for us. You know, we always try to be very inclusive and make sure that everyone that wants to participate has the opportunity to do so. So B, would you do the presentation for us?
Of course. Thank you, Sherry. Good afternoon, everybody. My name is B. Torres. My pronouns are she, her, hers, and I will be your Spanish interpreter with the Community Language Cooperative. I want to thank you all for your commitment to language justice. Language justice means that we should all have the right to speak and be heard in the language of our hearts. Therefore, I will be providing simultaneous interpretation for this afternoon's meeting. Once I finish speaking, we will activate that interpretation function, and at that time, at the bottom of your Zoom screen, you'll see a globe icon that reads interpretation. Please click on that icon and select either English or Spanish as the language of your heart. If you are fully bilingual in both English and Spanish, you do not need to choose a language. Please remember to speak at a conversational pace so that I'm able to provide an accurate rendition of your message. Hola, buenas tardes. Mi nombre es B. Torres y yo seré su intérprete con la Cooperativa Comunitaria del Lenguaje. Les agradezco mucho su compromiso a la justicia del lenguaje, lo cual significa que todas las personas tenemos el derecho de hablar y ser escuchadas en el idioma de nuestro corazón. En un momento activaremos la función de interpretación y entonces aparecerá un icono de globo terráqueo en su pantalla de Zoom. Por favor de hacer clic en ese icono y elija inglés o español como el idioma de su corazón. Si usted es bilingüe en ambos idiomas, no es necesario escoger uno. Le recuerdo que por favor hablen a un ritmo de conversación para poder brindar una interpretación precisa de su mensaje. Muchas gracias, ya comenzaremos. Thank you very much. We can begin and activate that interpretation function now.
Thank you, B.
Thank you.
I'm not seeing it on my screen. Is it coming up? Oh, here we go. It just popped up.
Sorry about that.
No, you're good to go. Okay, let's go ahead and right away and just jump right in. Jim, I'm just going to turn it over to you so that you can do your presentation and also introduce your team.
Excellent. Well, thank you very much, Sherry. And to the Board of Health, I have given you updates periodically at the business meetings over the last several months about the Climate Action Plan and the work that the county and the Sustainability Commission for Jefferson County have been doing in development of the Climate Action Plan for Jefferson County. So instead of me saying much, I'm going to introduce, and I'm very pleased to introduce two folks that'll be giving a presentation. At least one of them will be giving the presentation today, but I want to first introduce Jabez Mullimans from the County Facilities Management Organization here or department here at Jefferson County. Jabez is a newly seated sustainability coordinator and will be the project lead or the ongoing project lead for the Climate Action Plan implementation, as well as he's been working very closely with all of us on the development process. I'd also like to introduce Jeff Wong. Jeff is a member of the Sustainability Commission and has been actively involved in the development of the Climate Action Plan that will be presented to the Board of County Commissioners next month for hopeful adoption. And with that said, I've had enough of my time. Jeff, I'm going to hand the presentation over to you.
Sounds great. Thanks, Jim. As Jim mentioned, I'm part of the Sustainability Commission. We are a volunteer appointed board by the BCC, the Board of County Commissioners. And our mission and our goal is to advance sustainability issues and advocate for the community when we're talking about climate. And our big project the past several years has been trying to develop the county's first climate action plan. And we are very lucky to kind of be at the tail end of this project. So we've been working closely with county staff, Jabez leading that effort, as well as Jim and several members of public health, because as you'll see in a moment, there is quite a bit of crossover between the work that we are proposing in the Climate Action Plan, as well as the work that public health department is really focusing on, especially in the space of climate equity. in health equity. I will share my screen. Can someone just give me a thumbs up that you could see that? All right, great. All right, so really the history of the plan is that it stems from a resolution that the Board of County Commissioners adopted in 2020. It was the first climate resolution in the history of Jefferson County. So we were really excited to have the Board of County Commissioners adopt that. And within this very long resolution, there are specific directives for the county to create a climate action plan that really focuses on mitigation of greenhouse gas emissions and adaptation as well. And we wanted to make sure that the county is consistent with or exceeding the state goals that they have set. And then secondly, there's also language in there specifically to address underrepresented communities. We wanted to make sure that we were hearing the concerns and voices of underrepresented populations during this planning process. So, why are we here today? Why have we worked so closely with Jim and Harriet and other folks in the public health department? It's because there is such a strong connection between the impacts of climate change and health equity. This is a graphic that I borrowed from the California Climate Change and Health Equity Program, and I think it shows kind of a nice way to represent how everything overlaps, how the impacts of climate change that we experience, that we know we're experiencing now, like rising temperatures, more extreme weather, wildfires in Jefferson County, increased drought, flooding, how are these impacting existing health conditions, and how are they exacerbating the health inequities in our community? So we know, for example, that, as I mentioned, extreme heat is a consequence of climate change, but we also know that the populations that are experiencing extreme heat are historically have been marginalized, have fewer resources. How can the county respond to those lack of resources through this climate action plan? So kind of with that, we developed this year-long process of developing a equity-focused climate action plan with strong ties to health equity and climate equity. Right now, we are kind of at the very tail end of this year-long process. We are in the public comment period for the next 2 weeks until November 27th. And then, as Jim mentioned, we are planning on going in front of the Board of County Commissioners with a hopeful adoption of the plan at the end of this year. But we started off in January kind of organizing, figuring out what vision we wanted to take and working out the community engagement logistics, and then spent quite a bit of time on community engagement and putting this path forward together. So we've had a variety of stakeholders through open houses and surveys. We heard from 730 community members. Jim has been part of our project management team, which consists of county staff and sustainability commission members as well, that has been working with our consultant that helped create this plan. We've also had a larger steering committee, which has members and representatives from all the jurisdictions and several organizations within Jefferson County, both unincorporated and incorporated. And then we also held some focus sector groups that consisted of stakeholders, county members, municipalities, private industry as well, and then finally plan sponsors to help finance this project. So some highlights from our community engagement. We had a 2-month-long open survey for the development process. We asked just some basic questions, and we had some really great input on actually creating the survey from the the public health department that was really, really insightful to have some equity experts think about how we can get the responses that we really wanted out of the community. We also held 2 virtual open houses and had some engagement toolkits that we used to perform some additional outreach. So what did we hear from this community engagement process? We heard that the greatest risks that people are concerned about are extreme heat, drought, wildfire, poor air quality, and health risks. And again, all of these concerns are really exacerbated for historically marginalized communities. We know that that's been well documented throughout. So, you know, when we're responding to kind of these greatest climate risks, we want to think about how do we provide the correct resources? How do we respond in a way that doesn't put underrepresented communities at further risk? The benefits that most people were interested were increased access to renewable energy, better air quality, reduced wildfire risk, and access to clean water. We heard that time and time again, how important clean water is to everyone, really. And then nearly half of respondents said that they're willing to make some sort of change to reduce greenhouse gas emissions, even if it costs a little bit more. And then another third would agree to do that if kind of the upfront costs were offset later on. So with all that community input, that kind of helps us set the stage of the structure of the climate action plan. We have 2 specific goals that I'll talk about in a second. And then we went farther down and kind of dove into 6 specific sectors to address how we're going to reach these goals. So we had ecosystems, food and waste and water, as well as buildings, energy supply, and transportation. And then finally, we have developed some draft solutions on how to address ways that we can reach our goals within each of those sectors, and how are we going to implement that in the near term as well as the long term. So our 2 main goals are first to reduce greenhouse gas emissions by 73% by 2035 from 2015 levels, all while centering equity. The 73% was developed using a widely internationally adopted methodology called the science-based target. And that's to ensure that we meet the standards set forth by the Paris Climate Agreement. And then our second goal was really related to climate resiliency. We want to reduce the climate risk for all people with priority to those that are experiencing the greatest disparities. So again, we're trying to think about how we can address how communities can respond to the inevitable changes that climate change is forcing on us, and with particular attention to underserved populations. A little context for goal 1, which is the mitigation. We are trying to get to 73% below 2015. That's that green line down here. And then the orange line is what the state is proposing and what they adopted for their goals. So you can see that we are being a lot more aggressive than what the state is proposing currently or adopting. And then a little additional context from goal 2. I'm sure many of you have seen this. It's CDPHE's climate equity score. So we wanted to get a better sense and understanding of what are some of the existing disparities within the county in terms of climate risk. And CDPHE has created this data viewer that calculates a climate equity score, and that's based on environmental burden statistics as well as population characteristics. And if you look at the map here, the dark purple areas are parts of the county that are experiencing the greatest climate inequities. And that kind of gives us an indication of where we should be focusing some of the resources that the county has in terms of response to climate change. And then I mentioned those 6 sectors earlier, these 3, buildings, energy, supply, and transportation. Those are really focused on the mitigation side, lowering our greenhouse gas emissions, while water, food and waste, and ecosystems is more about resiliency, so a little bit more about goal 2. And then within the climate action plan, if you haven't gotten a chance to look at it, we have included like tips and recommendations on ways that residents and businesses can take specific action to help the county reach its goals. After that, we put together a list of solutions that we thought would help us reach both our mitigation and resiliency goals. We've put together 14 priority solutions. There's a lot on the slide, so I won't go over everything, but here's kind of a summary. We have these foundational solutions that will impact all sectors really, and then we've taken a look at each individual sector, provided a high impact solution, and evaluated how that will help us reach our mitigation and resiliency goals. Each solution identifies emissions reduction potential as well as resiliency benefits on a qualitative level. It provides some initial action steps that the county is planning on taking to help us reach our goals. Talks about the teams that are involved to get this thing going, as well as the resources that we need. And then there's always some equity considerations that we need to take into account as we're developing these projects to help us implement our solutions. Here's one example of what these solutions look like in the plan. So this one is specifically about building of new construction. We want to make sure that new construction is resilient and that it helps us reduce our greenhouse gas emissions and helps us reach our mitigation goals there. So we've outlined some preliminary action steps. For example, the county can focus on and lead by implementing an all-electric policy for its facilities. I mentioned the implementation team, we put resources, and then I really wanted to highlight the equity considerations here. So 2 examples that we provided is to prioritize policies for buildings that house or provide services for disproportionately impacted communities. So we're thinking senior facilities, affordable housing, low-income neighborhoods there, and then identifying ways to mitigate the costs impacts for housing or serving residents with lower incomes. So these are just 2 examples, and each solution that we're providing does have these equity considerations. Just because of our time, and I want to be able to answer some questions as well, I'm gonna kind of breeze over these proposed solutions here. We have the foundational ones I talked about. We're really focused on education and then emergency preparedness. Building solutions, I mentioned making sure we have new efficient codes for construction as well. There's priority solutions about residential homes and commercial properties as well. The energy supply solutions is really focused on renewable energy. And I know I'm flying through this, but I'm happy to provide the slides so everyone can take a closer look at this later. Transportation solutions are really focused on EV adoption in the near future, as well as multimodal transportation, land use planning. So increased access to public transit, walking connectivity, alternative transportation systems, things that we know have really not been well designed for lower income populations in areas of town. Ecosystem solutions, really preserving our natural environment. Food and waste solutions, we want to maintain access to healthy, locally produced and culturally relevant foods, maintain and increase, I should say. And then I think this is the last one, water solutions. As I mentioned earlier, water conservation was a really high priority in all the public engagement that we heard. So we want to make sure that access to water retrofits is affordable for low-income households so that we can help reduce water costs. And then as water becomes more of a difficult commodity for us to preserve, we want to diversify that water supply and make sure it's resilient for all populations here. This is kind of a pathway to how we're going to get our 73% reduction. You can see our focus is really on those 3 sectors I talked about: buildings, transportation, and energy. And then how we're going to implement all these solutions that I just talked about. Luckily, we have really fantastic staff with Jabez taking the lead on the county. And really their role is to coordinate and lead the effort between all the stakeholders that I've listed here. They're taking the lead in coordinating, creating projects, making sure they work with all the right stakeholders, including the Board of Public Health and the Public Health Department. And then we are really relying on our community partners to help us implement this. We understand that there is no way to reach this really incredibly aggressive goals that we've set for mitigation as well as resiliency without the help of our community partners. We need to get buy-in from our residents, our businesses. Otherwise, we don't really have a good chance of tackling this challenge. And then as we're doing this, we want to be really mindful that all our implementation steps are equitable. So here are just some examples of equitable engagement considerations that we put into the climate action plan. So as we're moving along, as various departments refer to the climate action plan when they're thinking about how they can help advance our goals, they can refer to these implementation steps. And we really welcome some additional comments and recommendations on how we can increase these engagement considerations. We've created implementation resources for the county, knowing that all these solutions will cost money. And so we want to be mindful of all the federal funding that's available soon. And so next steps, we are in that public review period right now. Next month, we're going to look in front of the Board of County Commissioners, and hopefully with adoption, we can focus on implementation next year. 3 ways that you can support the climate action plan adoption. First is to review the plan and provide comments by November 27th. Jabez, if you don't mind putting in the link to the climate action plan website into the chat, that would be great. There you can read about the plan. If you don't want to read all 100 pages of it or 60 pages of the text, you're welcome to look at the at a glance brochure that's available in English and Spanish. Once the plan is adopted, we are going to translate it into Spanish. Secondly, you can attend the December 20th Board of County Commissioners public hearing where they will consider adoption of this plan and voice your support. And finally, we really encourage everyone to share and talk about this climate action plan within your own personal and professional networks. So I'm sorry I only left a few minutes for questions, but happy to answer 1 or 2 of them. Otherwise, we can leave an email address as well where you can email questions.
Thank you, Jeff. Lane, I see you have a question or comment.
Thank you so much for the presentation and all of you for the work on this. And this is, to me, one of the biggest public health issues that we're facing as a county, as a world. So I appreciate all the work you're doing. And I want to look at it the glass half full. You had 50% of people that are willing to take action. Did you get any sense of why the other 50% aren't? So this is definitely an effort that's going to take really everyone, not just half of our community. But and if you would please also share those meeting information, and again, so that the Board of Health can help be supportive of your efforts too. I would like to do that to make sure that the commissioners, which I would assume they will be also very excited about this and supportive, but make sure that they do hear from us during that approval process. Yeah, I think that moving to that implementation is such a big piece. There's so many pieces of the puzzle to work on, and it can feel like an overwhelming process of where do we start to prevent our entire world's climate changing. It's already changing, so that adaptation and that resilience for the community is going to be essential. We're already experiencing the impacts, so I would love to continue to have input from this group too. So coming back to the board on some regularity, and also with those intervention steps of how the board can further support the work that you're doing.
Yeah, thanks for those comments, Lane. In terms of kind of those dates and how you can support us, I'm happy to send that information on to Jim, and Jim, I'll let you kind of forward that on to this group here. In response to the community engagement, I think that, we all probably know that climate change is not necessarily a priority for everyone in the community. Everyone has different priorities and focuses. For us in this space as part of the Sustainability Commission, we obviously really want to prioritize this because we think it impacts everyone, and we have this incredible opportunity to really impact community members, especially those that really don't have the resources to respond to climate change. And so, yeah, I'd say that a lot of the comments just, their focus and their priority is not climate change. So they're not willing to address that right now. And climate changes can be really hard to think about. A lot of the impacts are long term. It's not like one specific event, although unfortunately we've had quite a few of those here in the county and in the metro region as well. But I think that's part of the reason why climate change isn't necessarily on top of the list for a lot of folks.
Are there other comments or questions from the board?
Jabez, do you mind just dropping also the email address if people have specific questions? I think it's sustainability@jeffco.us.
Yep, that is correct. I'll put it in the chat.
Thank you. Jim,
Yeah,
is
well,
there anything else that you want to add, or Jeff, did you have something to add?
I don't. Just again, we'd love your support and input during this public comment period. We know it's kind of a tight timeline with Thanksgiving coming up, but if you have a few minutes to look over the plan, the public comment form is really easy to fill out, and it'll be open until November 27th. And if you're really passionate about the county moving forward on climate action, I encourage you to attend that December 20th meeting if you can, and if not, you can email the Board of County Commissioners directly.
Thank you.
And I'll provide these slides to Jim as well to pass on to the group.
Okay. Jim, anything more?
No, I just thank the board for your time on this topic today. Really important topic. I hope you see that there is has been a specific emphasis on equity, which I think our department stands to be a big help with trying to make sure happens as we move into implementation. So we've got a number of our equity and community engagement folks involved with the project. We've had some discussion at senior leadership about future resource allocations, both staff and perhaps financial resource allocations to continue the work that we've been doing over the last year. So we're looking forward to implementation and working with the county staff and working with many, many community partners to see this come to fruition.
And I see, Hilda, you have a question.
Yes, thank you, Cherry. And Jeff, you just mentioned a couple of ways that we can support by the public comment and reading. Is there any other ways the board specifically can support this initiative? Which, thank you for the presentation, and I think it was very comprehensive.
Yeah, I think one thing, if you can collectively agree to it, if the board is interested in doing some sort of letter of support directly to the Board of County Commissioners to support adoption, I think that is a great way to kind of voice your support and concerns regarding health equity and climate change.
Okay, well, thank you, Jeff, for the presentation and for that clear next step.
Thank you, Jeff. And thank you, Jabez, and all the others that are on the call listening for the hard work. It's been an interesting and an exciting project.
And a lot of hours. Okay, thank you. Thank you for the update. We appreciate it. Okay, let's move right into it. Is now we'll adjourn the study session and we move right into the business portion, which begins at 4 o'clock. With that, we will, should we do the language justice again?
I don't think you need to.
Okay.
I
I didn't know if you wanted me to do it twice. Okay. Lindsay, will you do a roll call, please? We're calling that to order at 4:01.
Sure. Hilda Gerke,
Present.
Harriet Hall,
Present.
Lane Drager,
Present.
Sherry John,
Present.
and for the record, Rachel Woods is absent and a quorum has been established. Thanks so much.
Thank you. And as Lindsay just mentioned, we do have a new board member. She will be joining us starting the next board meeting. So it is Rachel Woods. We look forward to meeting her. Okay, we will move right into the consent agenda. Are there any items on consent agenda that anyone wants to discuss that we need to pull off? Nope. Okay. Then we have on the consent agenda, the acceptance of the agenda, approval of October Board of Health meeting minutes, approval of warrants, approval of contracts. If there's no questions or any further discussion, may I get a motion, please, to approve?
I would move that we approve the consent agenda.
And a
Second.
Lane seconded it. And may we have a vote? All those in favor, just please say aye.
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 Aye. Any opposed? Say nay. Okay, that passes. Public comment. We actually don't have anyone unless, Lindsay, did anyone come in at the last minute of sign up?
No, they did not.
Okay, then we will move to the next one, the financial report. Selma, I see you are there. Are you ready?
Yes, I am. Go ahead and share my screen. Can everyone hear me okay? Okay, great. Yes. Okay. And can I get a thumbs up if you can see my screen? Perfect.
That's good.
Well, good afternoon, everyone. Today, I will be presenting the October financial statements. And as of this current reporting cycle, with 83% of the year completed, our total revenues are currently being reported at 70% of the annual budget. As I mentioned during the previous reporting cycle, this is below budget mainly due to our ELC grant and the fact that we are not going to be spending approximately $3.6 million of that grant due to the sponsor scope limitations, in addition to some savings from the transition of CTC and drug-free communities to the CNDC, or the new fiscal agency. Our charges for services are ahead of the budget by 4%. And this is because of our Vitals team. They continue to bring additional revenues year after year by expanding services not only to Jefferson County residents, but to other counties as well. And as of October, they have brought in $100,000 additional revenues to the department. Our expenditures are also at 70% of the annual budget. Salaries and benefits are at 63% of the annual budget. Again, this is expected because of the ELC and the fact that we're not bringing or hiring more positions for that word, in addition to some salary savings as well. Supplies and direct assistant line items, we continue to surpass these line items due to grants, budget reallocations, as well as some new awards that we received this year. Other charges for services, these are contractual services or professional and technical services, and we are ahead of the budget by 8% because we are contracting staffing for some of our short-term grants that we are not anticipating to get renewed next year or the following year. Capital projects and equipment are at 66% of the annual budget. Intergovernmental charges are ahead of the budget at 103%, and this was sort of expected because we are bringing additional revenues for Vitals, and these are payments to state for restaurant licensing and for issuing birth and death certificates. So we are bringing more revenues. Therefore, we are anticipating to continue to incur additional expenses in terms of payment to states. Intergovernmental expenditures or cost allocation are also ahead of the budget by 6%. And in terms of our fund transfer, we have utilized $6 million or 69% of our annual budget. At this time of the year, we are also expecting $350,000 of county transfer remaining. However, we are working, those funds are currently being considered to offset or to be utilized towards some of the unbudgeted projects, such as replacing IT equipment, the RGU for replacement. Any remaining funds will be considered for carryover to the next year or exploring with the county option to increase our fund balance. Any questions?
Are there any questions from the board members? Comments? Okay, seeing none. Thank you, Salma.
Thank you for your
May I get, then, if there's no discussion, may I get a motion to approve?
So moved.
A second, please.
I second.
Okay, may we have a vote? All those in favor, please say aye.
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 Any opposed, please say nay. That motion passes. Okay, let's move right to the new business. This is just a very brief discussion that I wanted to bring. The holidays get so incredibly busy, and I know people go out of town. And so my question was, what does the board think of canceling the December meeting and then just starting back up right at our usual time in January? Any thoughts?
So is there any business that's likely to come up between now and January that we would need to have a meeting for?
It was my understanding, probably not. Nothing that would be urgent that couldn't be done in
We
January.
couldn't wait till January.
Yeah.
Is the next scheduled meeting on December 13 or the 20th?
It would be that third,
The 20th.
the 20th. And that's just literally before Christmas. So I just know a lot of people get really busy and some people travel.
Yeah. My only concern will be, will this delay the hiring of the new director?
If what, I'm sorry?
If by us no meeting on the 20th will delay the hiring of the new director?
Well, I don't think so. Lindsay, do you have a thought on that?
I don't think so, but we can talk to Daniel. He's gonna give an update under old business.
Okay.
But I do not think so, because I think he was gonna see if we needed to extend the application process to the 15th.
Of January?
Of December.
Of December, okay.
But yeah, we can check in with him under old business here in just a little bit.
Okay.
Yeah, I have the same concerns as Hilda on if there's a need for us, a next step, certainly reviewing applications. I know that there have been a number that have come in, but again, we can talk to Daniel about what that process is going to be for us to start reviewing those and solidifying what the interview groupings will be and all that. So yeah, that would just be, not sure when that step is going to occur and what pieces need to happen in a public meeting.
Yeah. Very, very fair questions. Those are good questions. So we will have Daniel kind of give us an idea. Okay, let's move to the next new business item, the Jefferson County election update. Kelly Curl. There you are.
Yeah, can y'all hear me okay? Perfect.
Yes.
I just wanted to take a couple minutes, and I appreciate your time just to give a quick update on where things stand with midterm results. Across the country, ballots are still being counted. I believe that's true in parts of Colorado as well. So we don't have certified results yet for Jefferson County or for the state, but many of the votes have been counted. Jefferson County is currently sitting at 99% estimated count for the county. So I can provide a quick update about what the trend looks like for the ballot questions, both at the county level and then the ones for the state level that have a tie to public health. And then wanted to share a quick snapshot of some other public health ballot measures that hit ballots in other states, just so we can be aware of what some of the national discussions are as well. So at the moment, it looks like the 3 questions that the county commissioners put out to Jefferson County voters are not on track to pass. The first question about the county funding is fairly close and currently at about just over 50% no vote on that. And then the 2 questions related to retail marijuana and cultivation of marijuana in unincorporated Jeffco looks like they have been rejected or will be by the time any remaining votes are counted. Looking at our statewide ballot measures, Proposition FF, which is the school meals for all initiative, is on track to pass at 56, almost 57% of the vote, which makes Colorado the 3rd state in the country to offer free universal school meals. So we're following Maine and California, which have also done something similar. Proposition 122, which decriminalizes 5 natural psychedelic substances and then creates regulated access to psychedelic mushrooms, is on track to pass, which makes Colorado the 2nd state following Oregon to offer regulated access to psychedelic substances. So that implementation will be ongoing here soon. I think the board is set to be appointed, I believe, sometime in January that will oversee that regulation with DORA. Proposition 123, which creates additional funding for affordable housing projects across the state, is on track to pass as well. And then the last 3 that we were monitoring for public health were the 3 alcohol-related measures. And those at the moment have a little bit of a mixed result. It looks like 124, which increases liquor store licenses, is on set to be rejected by the voters by quite a wide margin. 125, which would allow grocery stores and convenience stores to add wine as an offering for the alcohol that they sell, at the moment is passing by a little less than half a percentage point as of the update this morning on Secretary of State's website. And then 126, which allows third-party alcohol delivery at the moment, is not looking like it will pass. It's sitting about 51% no vote on that from our voters. With some of the other national public health policies that other states had measures on, there were quite a wide range out there. Reproductive rights and abortion access, unsurprisingly, were on several states' ballots. Some states had measures on the ballot that codify abortion access and reproductive autonomy within state constitutions. And 2 states had measures that would further limit abortion access and reproductive health care and rights. And the overwhelming result across all of those measures was that voters cited to protect abortion care, reproductive rights, and protect their residents and their autonomy around reproductive health care. 5 states voted on recreational and retail marijuana, which passed in 2 states. 5 states voted on measures that would remove language that permits slavery as a form of criminal punishment within their state constitutions. And that moved forward in 4 out of the 5 states. The state that didn't move forward on that was Louisiana. And that really was around wanting to clarify the language in their measure. So the sponsor who put forward that measure on their ballot kind of pulled their support back and wants to get that language updated and made clearer, and then they will circle back to the voters in a future election. Voting access was also on the ballot in 5 states. Several states voted to expand voting access, which includes Michigan and Connecticut. And a couple of states voted to approve restrictions on voting access or adding additional restrictions to voting access. We're waiting on a result from Arizona, which would create stricter ID requirements for voting. Nebraska was voting on a photo ID requirement, and Ohio on an amendment that would explicitly prohibit non-citizens from voting. Nevada also was an interesting mix in this, in that they voted on ranked choice voting. It looks like they have approved that. So they are now an additional state that is voting by ranked choice for congressional races and certain state races. Several states increased minimum wage at the state level, and many states also voted on changes to their legislative process around how ballot measures could be placed on ballots, what percentage of vote might be needed to pass changes to constitutions. And there was quite a variety in this mix. Arkansas looked at something that would require 3/5 of voters to approve any changes to their constitution. Florida was trying to pass a measure that would remove a commission that might provide constitutional revisions to voters to consider, which is one of the few ways to make changes to the state constitution in Florida. And Arizona had several measures around whether or not the legislature could overturn a ballot measure approved by a voter or by the voters. They did pass a measure that requires ballot measures to stay to a single topic. So they have to be very narrowly focused moving forward. And then they also have one that's being considered around requiring measures in the future that have a tax implication to have 60% of the vote to pass. And that result on that measure isn't quite available yet. Arizona is doing quite a bit of counting still, but it was an interesting national picture when it came to public health policy. So we'll be monitoring to see as these results get certified and finalized, and watching for next steps as the things that have been approved will move forward so that we can be aware of those implementation processes. And then as our candidate races are finalized, working to plan and start doing some outreach to our remaining elected leaders who are staying in office, as well as working to build relationships with the new folks coming in as a result of this election, probably after the start of the year. So with that, I'd be happy to take any questions you guys might have.
Questions from any of the board members? Thank you, Kelly. I appreciate you doing that. Is there any further discussion or comments? Okay.
Sorry, Cherry, can I just
Yes, Hilda, go
make
ahead.
a clarifying comment? Kelly, I just want to confirm that the process that is taking longer to hear some of the results is kind of typical when you have elections. They are no very clear either for or against. The usually counting of votes sometimes takes days after the election day. That this is something typical and common on election day.
It is, and there's a lot of variety across the country, which I think makes it even more confusing for folks to try and track election results. I think a lot of folks, and I understand why, expect that we'll have results Wednesday morning, which is not the case. I think some of the delays in Arizona relate to whether or not they can count early votes and when they can count them, and different states have different requirements related to that, and rechecks and recounts, and there's a lot that goes into counting votes and tabulating results, and it does take some time. Even being a week out today, we're still waiting for some races to be determined across the country.
Okay. Thank you, Kim.
Any further questions or comments? Okay, thank you, Kelly. And Trenton, I believe that you're here to give us a brief update on Jefferson County Love My Air project.
Let me step in just for
Jim.
a second and introduce you all. I'm very pleased to introduce Trenton Mitchell. Trenton, joined us a little over a year ago with the specific intent of expanding our air quality program here at Jeffco Environmental Health Services. And Trenton and a team of folks from JCPH joined forces back in January to develop this grant application that we're going to share with you today, which will result in us joining in, and I'll let Trenton speak to the details, but really expanding our monitoring capabilities, not only in Jeffco, but also expanding the overall air monitoring capabilities across the Denver metro area. So I'm really pleased to have Trenton here today to share some really great news about an exciting new air monitoring project that we are embarking on here in the next few weeks. Trenton?
Thanks, Jim. Appreciate it. I'm going to try to share my screen here. So if you guys could let me know that you've got that.
There you are.
Good deal. I'm going to close this out.
There you go.
All right. So yeah, appreciate it, Jim. Yeah, I'm here to talk about the recent award that we received under the EPA's Enhanced Air Quality Monitoring for Communities briefing grant opportunity that we applied for earlier this year. I'm going to summarize generally what this grant competition was, our general approach, and what we're going to be looking to implement. So without further ado, The funds that we received were allocated through the American Rescue Plan. EPA ended up awarding around $53 million across the country to fund 132 air monitoring projects. These are intended to address environmental and health outcome disparities stemming from pollution and the COVID-19 pandemic. We were one of 7 recipients of this award in Colorado and one of 6 in the Denver metro. Generally, we're hoping to use these funds to help address air quality information gaps in underserved communities within Jeffco, specifically by implementing a Love My Air project, which I'll summarize in a little bit more detail in the subsequent slides. The total award sum is $225,000. The project term, it was originally supposed to be October of this year through September of 2025. That was based off of a target receipt date that EPA hasn't met to this point. So I would imagine that that timeline is going to get extended out a little bit further. So as we had talked about, we're going to be looking to use these funds to implement a Love My Air program within Jefferson County. And this is a program that Denver Public Health and Environment created a period of years ago. That was a partnership between the public school system and the health department. Generally, it outfitted schools throughout Denver with air monitoring equipment and then used those to both educate the public, collect information for the department's use, but also to engage in things like community engagement, public health information, and other education programming at each individual site. So this is a great program that was intended to be replicated. I'm happy that we're going to be able to do it in Jefferson County. There's a good network of resources and personnel that have been working on this sort of project for a period of time now, and I think we're going to have good support to make it a successful program. And as I talked about before, the purpose of these funds, the reason why this grant even exists is to help address disparities when it comes to environmental justice. So similar to, as we saw in the climate action briefing earlier in this call, we used the Colorado EnviroScreen as our primary tool to understand where disproportionately impacted communities exist within Jefferson County. We did a cross analysis between that and where prospective partners exist throughout the county. Some of those prospective partners that have already expressed interest and support in our program during the planning phase are listed on this slide. But now that we've actually got funding, I'm hoping that we can expand that list to include a lot more of interested parties. So yeah, and the reason why this is so important is because Jefferson County, we have a data gap when it comes to particulate monitoring. Particulate matter is the primary pollutant that's put out there when we have a wildfire event. And as we've talked about again during the climate action plan, that's an issue that's only going to be exacerbated in the near future. So I think it's an important use of these funds, and it's definitely something that we're going to be able to put to good use. So it's very exciting. Generally, how this works is I've sort of talked about it a little bit, but in this example graphic, a project partner site is listed as a school because that's how the program was initially designed. We're definitely going to be looking to partner with Jeffco Public Schools, but also going to be looking to engage community groups, libraries, other facilities that provide services for underserved communities as project partners and host sites. So each one of these would get outfitted with an air quality sensor, and we're going to be looking to utilize low-cost, cutting-edge air pollution sensor technology. These can be developed with solar power, battery storage, and data connectivity. So these instruments are used to collect information about particulate matter concentrations. It goes through a statistical correction to remove any biases or other factors that could influence the data to make it as accurate and usable as possible. And then it goes onto a public-facing dashboard, and an example one is in this graphic. It's color-coded to the air quality index, as you might be familiar when you check the weather on your phone each morning. But that's something that would be specific to every host site. It's something that we're going to be able to access via a mobile application as well. So I think it's exciting that we're going to be able to educate people at both the project sites, but just at the community level at large about what their exposures are, so they can make decisions about protecting their health. And as I had mentioned, all of these are to monitor for particulate matter. As we put the application together, we came up with these goals and objectives. So I'm not going to read through all of these, but generally our project goal is to empower people in Jefferson County communities that are disproportionately impacted by air pollution to understand their local air quality with immediate hyper-local air quality information. And as we receive funds, which I don't think will happen until near the end of this year or early next year, we're going to be looking to finalize our list of project partners and outfit them with air quality monitors. We want to develop the kinds of programming that would be useful to them. This could be unique to every site, and it leaves a lot of room for creativity. And we have some really talented people within our department that I think are going to be able to do some great work for them. We want to analyze this information and not only inform the public in the sites, but also inform things like the health needs assessment or things like the climate action plan, where, as I've mentioned, there's currently a gap in information about particulate matter because we're just not monitoring for it currently. And then there's other objectives about maintaining compliance with reporting requirements from the funder. And then we also already want to start thinking about continuing this project after the third year, because we're hoping it's going to be a popular and successful program that we're going to be hoping to continue after that 3-year life of the project. So my last slide here is just a few people that helped out during the planning phase of our application. Without these guys here, we definitely wouldn't have been successful. Everybody brought something different to the team, and I'm just really thankful for them, and I hope that they get the praise that they deserve. And yeah, that's really all I have. I'm happy to answer any questions anybody might have, but that's all that I have here.
Thank you, Trent. That's a great presentation, and that is a really important topic. Do we have other comments and questions or questions? And we do want to thank your entire team, because that is a big undertaking, kind of an exciting one, but it's a big undertaking.
I'm glad it was a good use of their time.
Definitely. There's a media event planned for this coming Friday. Will be held at the Broken T Golf Course Clubhouse in Sheridan, Colorado. There'll be representatives there from our local congressional districts, as well as the EPA Region 8 administrator, and that's Casey Becker now, and representatives from all of the various agencies or organizations that have received funding in the Denver metro area. Interestingly, amongst the two of us, the 3 local public health departments, is it 2 or 3, Trent? I think 2. Tri-County Health and Jeffco Health got some funding, but also there's 2 community-based organizations, one in Aurora, one in North Denver, that have also been awarded a substantial amount of money to do additional community-based air monitoring. So it's kind of exciting time. I think the last thing I would say here is that this is really a first step into the door of really trying to incorporate environmental justice issues or environmental justice considerations into the work we're doing here at the Environmental Health Services Division by collecting this type of data and potentially identifying any types of air quality or health related issues related to air quality. We also, and working with our local community-based organizations, it helps us to set them up to become active participants in policy change initiatives over time. So that's what environmental justice is all about, is about empowering those communities to really step into these issues and pursue policy change, pursue what they need as communities to provide greater protection to their health related to environmental factors. So we're really excited about the possibility that what we do with this project will lead to even greater things in terms of either whether it's climate change or health policy around air pollution. So, and maybe other things too. So I know I'm excited. I've been in this field a long time, and it's really been exciting to just really step into some of these topics that have become kind of front of mind issues all across Colorado.
Thank you, Jim. Are
Thank
there
you, Troy.
any comments or questions? Okay, well, thank you. I am going to back up just for a quick second because I know that Daniel is here. I'm 99.9% sure. And I'm going to ask him to give us an idea if not meeting in December would, cause a barrier of any kind. And the reason I'm doing that is because that really is new business and it would require a vote. So that really needs to be done under new business. So I'm going to back up and ask Daniel, are you there?
I am here, Madam Chair. Yeah, I'm trying to get my camera set up here. So
I'm not sure if you heard the question.
I did. I was on. I did hear it, and
Okay.
I would have chimed in then, but I couldn't unmute myself. So I do not think that having a December meeting is mandatory per the search. I think we could use that additional time to continue to vet candidates and allow response to come in. Just to give you an idea, in the last week, we've already received 19 new responses since last Friday. So interest is strong. We're continuing to get a number of people to apply, which is very gratifying, and it gives us options. So of those 19 of the total number, which is now up to 54 people that have applied, we classified 16 thus far as being worthy of what we think is additional scrutiny consideration. Of those 16, 4 have already returned the supplemental questionnaire we created. So those are awaiting my review, but I'm quite pleased with the response we're getting. And Lindsay sees our weekly reports as well. So Lindsay, I don't know if you have any comments you want to add or not, but Madam Chair, in regards to the December meeting, unless you have other pressing business that needs to be addressed, I think it would be, given that it's a very busy time, probably won't impact the search at all to cancel that meeting, postpone it till January.
Okay. We'll have a discussion on that now. And Daniel, I do have you in just a few more minutes to do an even bigger update if you have one, but I appreciate you jumping in to answer that question. What do the other members think of not having the meeting in December and just waiting until January? I'll open that up for discussion.
So I think that the 20th is awfully close to the 25th, and that not having that meeting would be a very good idea.
I'm fine either way. So if something does come up, it's currently on my calendar. So and if it gets canceled, that will free up some time. So
I'm the same boat in Lane. I don't have any plans for the week. I was planning to be there. So if we cancel it, it doesn't affect my schedule. And if we have to meet for any reason, I can make myself available. So
Okay.
Sherry?
It does require a vote. Oh, I'm sorry, Carrie.
Yes, I believe what I would ask the board to consider is if you're asked to, let's say, execute an agreement that must be approved before the end of the year or considered by the Board of Health before the end of the year, that you leave that meeting open to address that. I think there's a human services contract that needs to come before you all before the end of the year. And so just wanted to raise that for the board's consideration, that there may be in fact something that comes that needs to be addressed by year end.
Okay, how would we word that in a motion? Because we have to either vote yes, we can make it into the words that we can, if need be, we could, call a meeting in for that date. But otherwise cancel the December 20th meeting.
Cherry, I don't know if I want to throw this in the mix, but is it possible to move it to the 13th in case we need to meet by the end of the year, or that will bring another complication?
Lindsay, do you have a thought on that? I don't.
My only thought on that is I'm not sure the contract will be ready.
Right.
But Carrie would know, I believe.
Why don't we leave it like this? Because we do have to vote on that. So if we can vote to suspend, to cancel the meeting for December, if need be, we can call a special meeting for the same date if something comes up that we have to meet really quickly. I don't foresee that, but we would have that option. Does somebody want to make a motion for that?
What's the advance time frame to cancel a meeting? Again, I'm comfortable leaving it there just as a placeholder and then canceling it either the week before or whatever we need to. And I can make a motion again.
Okay.
Frame is.
And we would need to call a special meeting because we have to vote. So just whoever makes the motion, just know that we.
So we have to vote to cancel the meeting in a meeting.
I kind of want to make the motion that Len suggested, leave the date, and if we need to cancel it, if we don't need to meet on that day, cancel it 1 week before, but kind of want to make sure that we have a space to meet on December if we have to.
Well, can we take the vote at this meeting to cancel it if the Human Services contract does not require us to take action? So that's authorized to cancel it, but it's also still on the books if we need to have it for that particular person, for that particular reason.
Well, yeah, because then we would just make it, if we cancel it, we can still, everybody hold that date, but we can cancel it. And then if we have to use it, we'll just call a special session. The same thing.
Yeah. Yeah.
I think that's fine. I'll make a motion to cancel the meeting, and if we need to put it back on, we have plenty of time to do that. I think we only need 72 hours to put it back on. So
correct.
Okay, I'll second that.
Okay, we do have a motion and we have a second by Harriet. May we have is there further discussion? Okay, then we'll take a vote. All those in favor, please say aye.
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 Any opposed, please say nay. That motion passes, and everyone leave that date open just in case. Okay, old business. Joe, are you ready to do a CTC update for us?
I am, thank you. Good afternoon, everyone, members of the board. I'd like to take this time to revisit the discussion around the Communities That Cares program project and recap the funding sources and where we stand with those levels of funding, those contracts in place for those funding for opportunities for that program. Then I'd like to move into asking the members of the board to support the notice of termination letter for the Drug Free Communities Award, and then ask the members of the board to support moving forward with a memorandum of understanding between Jefferson County Public Health and the Colorado Nonprofit Development Center. So if I could recap, hopefully this is just a bit of a refresher, just to ensure that we all are on the same page with our understanding of these funding sources. For the Communities That Care program, there are two funding agencies, the State Health Department, the Colorado Department of Public Health and Environment, CDPHE, as well as the Center for Disease Control, CDC's Drug-Free Communities, CDC, those are the two agencies that are providing funding for this program. From those two agencies, there are 3 awards for the Communities That Care program. Under CDPHE, the 2 awards are the Communities That Care, usually termed the Communities That Care Award. However, it is the Community Organizing for Prevention Award. The term for that award is July 1st through June 30th. There's also the health, and let me also remind everyone that that is the award that was voted to relinquish the funding. There was a notice of termination, that was discussed and approved by the members of the board during the last board meeting, the October board meeting. In that letter, it was stated that we would be relinquishing that funding at the end of the current calendar year. I want to emphasize that that we are indeed relinquishing that funds because we do not have the authority, the opportunity, the option to transfer that funding. It is not within our spectrum that we can transfer funding that was awarded by a different agency. We don't have that authority over that funding. So we are slated to relinquish that funding at the end of the year. Within that notice of termination, there was a projected estimate in which will be available after we relinquish those funds through CDPHE. Will be available for CNDC, the Colorado Nonprofit Development Center. It will be available for CNDC to apply for that funding. Now, just to provide a little bit of clarity, and I know this is backtracking a little bit, revisiting some of the conversation from last Board of Health meeting. The reason for the time frame of December 31st is to allow the application process to be to allow that application timeline, the review of CNDC's application through CDPHE. Please keep in mind, if JCPH were to relinquish those funds immediately, and CNDC's application, the review of the application was months down the road, that would entail the situation, that would result in the situation we are all trying to avoid, that lapse of funding, the lapse of support. The intention with these conversations, the ongoing conversations between all the parties involved, our legal department, the JCPH executive team, senior leadership team, apologies, is to ensure that this program continues to thrive, that this program continues without any hesitation, without any lapse of support. And that is the reason for that time frame, why JCPH is relinquishing those funds at the end of the year to align with the application process by CNDC. Moving on to the second award under CDPHE, that is the Health Disparities Award. That funding has been made very clear by the State Health Department, by CDPHE. That is their desire, that is their recommendation that funding stay with JCPH. I won't get into too much of that conversation, but it appears as though that is not, although it is our option to relinquish that funding, there is not an option for another agency to pick up that funding. That also creates an opportunity for all parties involved to continue the support by JCPH in this program, to continue that collaborative approach. But again, there are limited options for that funding. So it is our intention to continue that support, to continue to manage the Health Disparities Award through the current award period, which is through June 30th of 2023. The third award sponsored by CDC is indeed the Drug-Free Communities Award. This is the award that you'll see on the agenda, has a notice of termination that is similar to the one that was reviewed by the Board of Health during the last Board of Health meeting. This award was issued in September, I believe on September 30th. So we received the notice of award just recently. However, due to the other funding sources available, we do not have an intention to utilize this funding. So we have discussed this award, and I believe it is in everyone's interest that we relinquish those funds in the near future to allow alignment with a more expedited application process by CNDC. Unfortunately, I do not know, and I don't have readily available the timeframe in which CDC anticipates the review of the application by CNDC for the Drug-Free Communities Award, nor do I know where CNDC is in that process. I apologize, I don't have that information at this time. However, we are asking that we relinquish, that the board support the notice of termination letter that would allow for the relinquishing of these funds that we have not utilized up until this point, nor do we have intention to utilize due to other funding sources available, that we relinquish these funds as of the end of this current calendar, the current month, apologies, November 30th. I believe within the Board of Health packet, that letter is available for you to review, for you to reference. I'm not sure, I believe the date is November 30th. Keeping in mind that although we have no intention of utilizing any of that funding between now and the end of the month, it does allow for some time frame for CNDC to consider that funding to, I believe, submit application, but also to give notice to CNDC and all the parties involved, the Jeffco CTC program as well. An immediate relinquishing of that funds, I don't believe would be to anyone's advantage. So we are providing a little bit of flexibility with that timeline in order for any questions, comments to be addressed here in the next couple of weeks. However, moving on to the agenda items, the request that I have for the Board of Health is to support the notice of termination letter that you have in your packet for reference. Please note that not only there's the date that I brought your attention to, but also that we are requesting that Jody Irwin, the Deputy Director, JCPH Deputy Director, authorize or execute this letter of termination, notice of termination letter, due to his standing on the award. He is, I believe, the point of contact. I believe he is written on this award, and therefore he is the representative for this award, and that is why we are asking for support by the Board of Health to execute this letter by Jody Irwin, who is, because of his role on this grant. I wanted to take a quick moment to see if there's any questions, as this is indeed the first action item. I would ask that the Board of Health vote for support.
Are there questions, discussion, comments? You must have explained it very well.
I think I just talked long enough. That's usually Sherry, Madam President, I'm so sorry. As I wrap up the CDPHE awards and then attempting to move on to this letter under the drug-free communities, I wanted to reiterate that JCPH does intend to retain and continue to perform to address the deliverables under the Health Disparities Award. So as we go through these funding sources, I want to make it very clear that we are not relinquishing all funds. We are relinquishing those funds that CNDC will indeed be applying for. So I hope to address any questions involved with those funding sources before moving on to support for this letter, the notice of termination.
Thank you. Questions? Okay.
Is it possible, Madam President, that I ask if you'd be willing to move toward a vote of support?
Yeah.
Let's move
I was
forward.
I was going to do that so that we don't have to wait till the end. So we need to have a motion.
I'll move to support the letter that has been drafted.
Okay, do we have a second?
I'll second that.
Okay, sorry.
It's been seconded. Okay, any further discussion? Seeing none, we will have a vote. All those in favor, please say aye.
Aye.
Aye. Any opposed, please say nay. Okay, that motion passes. And now you have another one for us.
I do, and I can't tell you how much I appreciate separating these items just for clarity, for clarification with the minutes and for discussion as well. The next item on the agenda is the memorandum of understanding between JCPH and CNDC. At this point, unfortunately, we do not have a letter for reference. We do not have a letter for review, as this letter is still in draft format. There are a few items that are still being discussed, such as the inventory that may or may not pass along to CNDC as they take over as the fiscal agent under this program. I would like to, and I feel like maybe I jumped a little too far ahead, but please let me give a general understanding of what will be entailed in this memorandum of understanding. Bear with me, I have too many things open. Apologies for the short delay as I skip between one. There we go. The memorandum of understanding. Apologies, trying to get organized. Apologies. The MOU between JCPH and CNDC will not only have recitals to clearly document what has transpired up until this point as to who has had ownership over these awards. As I mentioned, there are two that JCPH is relinquishing. So these two awards, the Drug-Free Communities Award and the Community Organizing for Prevention Award, are clearly stated in this MOU, and our intentions to relinquish these funds, as well as, like I said, identify some of the events, some of the ownership of the project up until this point. What we are establishing is clear understanding of how we are moving forward in this relationship, identifying the awards, clearly stating the awards, the sponsoring agency, and the transfer of, the relinquishing of responsibilities from JCPH, and the potential for Colorado Nonprofit Development Center to then pick up those responsibilities, and the timeframe associated with that transition. Like I said, there are not only just a couple small pieces that we are discussing internally to ensure that this is a very thorough understanding, the thorough MOU, such as some of the assets. I want to assure the Board of Health that the assets being considered I would not consider material. They are not of significant value that would have any budgetary impact. These are items in which were purchased with some of the funding that JCPH will be relinquishing. Some of these items, although could be considered to have some value, the age of the equipment, IT equipment, shows that they would have very minimal market value. So, and then again, there's some other items such as promotional items, incentive items, things like that we're going through the list. I assure the Board of Health that we are in support of providing CNDC with the materials that would be considered assets purchased by the grant funding that JCPH will be relinquishing. But again, it is just some of the fine tuning of the award that we would like to complete before we have this for execution. At this point, and I want to make sure that I address items on my checklist. I believe in the past, I'm not sure during which meeting, the Board of Health had some concerns with staffing, JCPH staffing, and whether they'd be transferring or have opportunities with CNDC. Although I cannot comment on those opportunities that would be available at CNDC, the Colorado Nonprofit Development Center, I want to assure the board that we would, within JCPH, find opportunities for those staff members if they do indeed seek to retain employment with JCPH. The reason why I can say that with some certainty is that, first and foremost, these are very valued staff members, but this is a very small team. And there's a lot of opportunities within JCPH, and we are looking at some open positions that I believe provide some flexibility with our staffing and a lot of the programs that we are still operating. Some of the programs that not necessarily mirror what CDC is, the CTC program is doing, but would create opportunities that the employees may consider if they so wish to do so. So I just want to assure the board that we would not be in a situation where we'd be looking at termination of staff members. I hope that addressed in some bumbling way, addressed the concerns of the Board of Health. However, I'd like to, if there are questions that I can help address, please let me know. At this point, what I am asking the Board of Health is for support to move forward with a memorandum of understanding between JCPH and CNDC. And if there is any questions that I could help address.
Any questions from the board members? Lane, you have a good handle on this. Do you have any questions?
No, I mean, if you're just asking for conceptual support to work through this MOU, it seems like our contracts are always, if Sherry's the one signing them, she signs them, and then we still review them at the next meeting if there's sort of other pieces. So it doesn't seem like this needs to upset that normal process. So, but if it's approving a yet to be drafted MOU, I don't feel comfortable doing that.
Lane, I do apologize. First of all, thank you for those comments. And I believe at this point, it is Jody who would be executing this MOU. As this is really documenting what we've already discussed. I don't believe that there would be any concerns that have not already been addressed, as this is just clearly and formally documenting a lot of the conversation that has occurred up until this point. It is as this does not have any financial bearings, as this is essentially putting, recapping and establishing that relationship that is built off of those notices of termination that the Board of Health has either considered, executed, or supported up until this point. As also this MOU is working off of the recommendations of the Board of Health to collaborate with Jeffco CTC as well as CNDC. I believe moving forward, it is appropriate for Jody Irwin, Deputy Director, to execute this document. And as I don't believe there are any items that would be discussed or documented that have not already been considered and evaluated up until this point. Lane, I hope that helps the conversation, but please let me know if there are other concerns.
No, I think in general, this whole piece has been a little challenging. I know it's because there's been sort of the controversy around, the desire of the community group to sort of separate faster than maybe everyone was ready for that to happen. But so again, to me, a lot of this still feels like it does belong in the administration within the department, and it's not stuff that the Board of Health needs to weigh on as far as which grants you apply for, which ones you keep, you don't keep, which staff are going to work on them. Those are all very much internal administration that the staff working there should be making those decisions.
Lane,
So,
if I could.
go ahead. I was just going to say, so I do support the idea of creating the MOU as we've kind of talked about, so that we can make this transition, and then Jody can obviously execute that.
Thank you, Lane. Apologies for the interruption. You bring up a good point, and that is the timeline, and that is the one thing I neglected to discuss as well. The reason for this is the reason for this request. And again, as much as I had hoped we would have a letter to review to make this conversation, this request a little bit easier, it's the time frame in which I'm concerned about. If the Board of Health is intending to cancel the December meeting, if for some reason it's an abbreviated meeting, I think it gets us too close to the period in which we are relinquishing these awards, in which we really do need a formal understanding of the relationship between JCPH and CNDC. So although although I would prefer a different approach, I feel like my options of request of the Board of Health are limited with the timeframe ahead, with the holiday schedule, with the potential with the potential canceling of the Board of Health meeting in December. So again, this is unorthodox, but I feel like this is in the best interest of all parties, and having the Board of Health support to move forward with an MOU would be much appreciated and beneficial to the timeline at hand.
You know, I have to agree with Lane. I mean, you all do contracts day in, day out, and we don't define those contracts because it is under the, you know, the duties of the administration. So, I mean, as long as it's everything in there is exactly what we have been discussing. So I also feel, as Lane does, that I'd be okay. Hilda, did you have a comment?
Yeah, I wanted to kind of agree with both of you. I was trying to understand exactly what the request was, and I kind of was concerned about signing or approving something that we haven't seen written. But I completely understand what is that time concerns, and I don't want to slow down this process in any way. My only comment will be, can we review it after it's written and approved, and put it up to discussion if it's something that it looks like we need more information. So that will be my only comment. I would like to have the opportunity to see it once it's written and signed once more, just to make sure the aligns with what we're talking about.
Thank you, Hilda. I grit a little bit because I'm realizing with your comments that I did kind of, I don't think I was clear with the request. The request for the Board of Health, my request for the Board of Health is to support JCPH establishing an MOU to clearly define the relationship between JCPH and CNDC. I absolutely agree with you that the Board of Health, under the circumstances, but just good practice, that we share that MOU with the Board of Health upon execution. We can continue to have this discussion, but we are getting close to that timeline in which we are relinquishing these funds, that we will no longer have, we will no longer be managing these funds. So it is important to have this MOU in place. So I hope that made it a little bit clearer. And again, apologies that I trying to provide an extensive amount of information in a short period of time and yet still have a clear ask for you. So thank you for bringing that to my attention. Apologies for making a little bit of a mess of that conversation. So thank you.
No, thank you for the clarification, Joe. That makes it a lot more clear for me. Thank you.
I also want to thank you for that clarification. And I'm now, I think, on top of all of this. And basically what we're saying is you need to move ahead doing administrative things. And we as a board need to not be micromanaging the things that really are administrative management responsibilities. And you'll keep us informed with what we need to know. So that's good.
Okay.
Thank you, Dr. Ho.
Joe, we're making progress. With that said, if there are no more questions or comments, can we get a motion for the board to support? Lane, you're so good at those.
Well, to be pretty basic, I move that we support staff moving forward with a MOU with CNDC.
There is a motion. May I have a second?
I would second.
It has been seconded. All those in favor, please say aye.
Aye.
Aye. Any opposed, please say nay. Motion passes. Thank you, Joe.
Thank you, everyone.
Okay. And now we will call back up. Thank you, Daniel, for hanging around. We appreciate you. We would love to hear an executive director hiring process update from you. If you have other things to add, I'm sure you do.
I kind of got a little bit ahead of myself with the last quick report I gave, Madam Chair, and unfortunately I do have to run pretty quickly. I've got another conflict in just a few minutes, but quickly, we have 56 total candidates that have applied thus far. Outreach is continuing to more candidates. Of those 56, you may recall me mentioning, we classify 16 as being folks we consider under consideration. And a question was raised evidently about why are some folks not qualified or falling into our second tier. And honestly, that is, there's been some close calls there. If there are folks that don't have the education we're looking for or the experience, perhaps they've been in healthcare on the for-profit side. There's a variety of factors we're considering, but to say we've got 16 that we consider qualified and that number will likely grow, I think is very encouraging. So I'm pleased with that. I hope you all are too. This is the fun part when we start getting into the winnowing process of deciding who are the best candidates of these people, and that's about to begin. So I entertain any questions. I'm sorry, I have to make my report kind of brief. So
I think that's fine. Questions? I appreciate the update.
Thanks, Daniel. I have a question related to kind of when are we thinking about starting to look at the top tier? Just one of those, I think, nuances of hiring that you're probably very familiar with is candidates apply and are interested, but they're not looking at just one single job. So if we have the candidate pool sitting there for months, that some of those people might not be there anymore when we finally start looking at them.
You hit the nail on the head, Lane. That is certainly the case with candidates that are well qualified. They're going to have other options, and so we want to keep the process moving with them. As I mentioned earlier, we've asked them to complete a supplemental questionnaire thus far, and this is just a snapshot as of right now. I have 4 of those returned, awaiting my review. That is going to be my pre-Thanksgiving weekend plan, and I hope to start interviewing those folks right after the Thanksgiving week. Next week is probably a better week for reviewing than actually interviewing, but I hope to start doing those when we return from the holiday to keep the momentum going with any folks that we do consider, very attractive, viable candidates for this role. So.
Great.
And going along those lines, Daniel, thank you for the report. When are we expecting to be interviewing those candidates as a board as well? If you can give me an idea of how is that going to work out? What is the process?
I think it's likely that it's going to be after the holidays, Commissioner. I think that, we talked earlier about potentially, letting go of your December date. If it's December 20th, how many candidates are going to be around the interview during that time? I'm not sure. It kind of depends. I'll know a little bit more. So I like the fact that you all discuss that if need be, you can reschedule a special meeting. But I'm just guessing, and it's largely predicated on people's availability and how quickly they respond to us with the additional questionnaires we hope to get. But I'm guessing most of December would be spent me interviewing candidates with the hope that I would have a vetted slate of folks for you to consider right after the holidays, early January. So.
Yeah, thank you. And please don't hesitate to let us know if we need to meet, even if we don't have the 20th in the calendar. I don't want that to be a reason for not moving this process forward because of the concern that we talk about. People might not be there if we wait too long.
Yeah, thank you for mentioning that. And I promise to keep in touch with you all. And if it appears we've got a handful of candidates that, may not be around. If we wait 2 weeks through the holidays, then, we'll certainly call that to your attention and see if we can get a meeting organized quickly. So.
Okay.
Okay, that's encouraging, because it can, if you have a really good top-notch person and you know that they're like looking at another job, why we need the flexibility of moving quickly. So, yeah, good.
You're right. It is complicated a little bit just because of the holidays this time of year. That's happens with every search that commences in the late fall, but we just will read the tea leaves and, kind of borrowing a term from pro football, read and react if we need to. So.
Well, and we are really good. This board is really good at calling meetings and special meetings and pulling them together quick. And this is a priority. So thank you.
Can I mention just one more thing? I know you mentioned that you have other commitments and I want to respect that, but there is an opportunity for staff comments at the end of our meeting, maybe in next meeting. I know there is some staff that would like to mention or make some comments regarding the hiring of the new director. So maybe we can send those comments to you if they're made, but that will be a great opportunity to also for you to hear comments from the staff for future meetings. Hopefully we don't take too long. Hopefully we don't have to do this for too many meetings, but just for consideration.
I'd welcome that, certainly, if that's available. So.
Thank you.
Any other
Okay.
questions, Madam Chair?
Yeah.
Any other questions for me?
Oh, any other questions for Daniel before he zips off to his next meeting?
Thank you, Daniel.
Thank you, Daniel, for the update. We appreciate it.
Happy Thanksgiving to all of you.
Yes, you too. Be safe out there. Okay, we are going to move right into the senior leadership team updates. And first up will be Jody Irwin.
Good
Will
evening.
give us an update.
Yep, just a couple quick things. First of all, update on the family services director that I brought up last month. So we have made a hire. We actually just wrapped up the paperwork today on this person. And you may recall I was incredibly excited about the candidate pool that we had. I actually had several people reach out to me from other organizations who heard through the grapevine that this person was a finalist. And they said we made a great choice. Even one of the other candidates said we made the right choice. So I had debated introducing them today. She won't start until January 3rd is going to be her first day. But actually, we just sent an email out to the team about 3 hours ago with the bio and introducing her. So I want to wait and make sure that they all have an opportunity to read the email and know who their next director is going to be before we announce it publicly. So more to come on that, but we've just heard amazing things about her throughout this process. So very excited. Along those same lines, the clinic services director position will be posted in the next couple of weeks. I think, that Gwen's been very graciously filling in for that position for the last several months. Just gave us an opportunity to settle things down post-COVID, where clinic was one of the very, central pieces of that, or one of the main groups that was heavily impacted by the last year and a half. So really helped us settle things down and take a look at what we really need in that position and evaluate that. So we've made just some minor tweaks to the job description, or we'll be doing that and moving forward with that posting here in the next few weeks. So that should go live. I was going to talk a little bit about some changes to the org chart with Kelly Keenan leaving and what we're thinking with her teams, or what has happened with her teams. But then that made me think we have many, many changes that have happened in the last 6 months to the org chart. So what I'd like to do is I'll start with asking Lindsay to share our most recent org chart with all of you after this meeting. And then maybe here first quarter of next year, it might be really nice to have one of our study sessions focused on that org chart, just to kind of do some Q&A and present that so that y'all are aware of all the very significant changes that have happened with that. I think that maybe February would be a good time. February, March would be a good time to do that. I will be out of the office for 2 weeks starting on Monday. So you can definitely reach out to Lindsay, Christine, or any of the other senior leadership team that you typically work with if you have questions around specific areas. I will be here Monday, but otherwise I will be pretty much offline for the 2 weeks after that. So And then I want to apologize for leaving somebody off our list of updates today. We didn't formally name Tatiana as the interim director in family services while we're doing our search. She is our WIC director, but I was going to ask if we could update to have her. I know she'd shared earlier with Lindsay and I that she would like to share some updates on behalf of family services in the interim. That's all I have for today, unless you have any questions.
Thank you, Jody. Are there questions? And we will make sure that, in fact, when we go into staff comments, I'll just make a note here to call on Tatiana.
Awesome, thank you.
Okay. All right, Joe, do you have any more to update? You've had your hands pretty full.
Just very briefly, I wanted to mention, especially if there is not going to be an opportunity during the December month to address any budget items. So I wanted to let the board know that we are in continuous conversations about any budget savings and in utilizing the county funds available. We are looking at a lot of opportunities, options to ensure that we use all of that opportunity. I know that that funding that could potentially be available. So as we consider having or not having as you all consider having or not having a meeting in December, please know that the team will continue to ensure that we are utilizing all of that funding stream as best as possible, taking advantage of those opportunities that would otherwise go unused. As you can imagine, as we go through this fiscal year, there has been some savings due to turnover, due to open positions, due to programs starting up, programs being fiscally responsible, as all of our programs are. Sorry to insinuate that. But we are looking at a lot of opportunities. So unless there's questions about budget, please rest assured that we are looking at all of the options available to meet our budget obligations. That's really all I had, unless there was some questions.
Lane, do you have a question or comment?
I don't.
Oh, you lit up, so I wasn't sure.
Thank you, everyone.
Any questions or comments for Joe? All right, Jim Rada, you're on.
Hi, I just wanted to provide one update, kind of in response to last month when the board heard a number of public comments regarding a development project planned for 5950 McIntyre up east of Golden in unincorporated Jefferson County. The staff has been aware of the pending project for some time because there's been development plans. There's a new owner of that property. There's been development plans underway for some time. Currently, there is just a grading permit application in place. It's not been approved at this point, but the permit application is in place with planning and zoning. The activity associated with that permit is just for relocation of a portion of the Farmers Highline Canal that goes through this property. The developers are desiring to move that canal so they make a little more land available for a planned development project. It's a commercial warehousing project, distribution center kind of facility. So you may know the property, or if not, this property has a long legacy of environmental contamination. It is considered a brownfield in the vernacular of EPA and CDPHE. It was back in the 1990s. There were a number of contamination issues associated with soil and some groundwater on the site. All of which were addressed through a cleanup process with EPA and CDPHE. The cleanup process resulted in a set of environmental covenants and environmental use restrictions on that property, along with a materials management agreement that really basically says if the developer wants to do anything on that property that involves digging the dirt up, that they have to make sure that they are that they have the proper people on site that are sampling the soil, that if they find anything that's contaminated, that they must do additional soil sampling and make sure that they're following the strict conditions of the environmental covenants and environmental use restrictions, as well as the terms of the materials management agreement, before they can move any further soil on site. There are also some requirements under the materials management plan that CDPHE has approved that requires the site to the developer or anyone desiring to move soil on that site to have an air quality, or to be watching, or I should say a dust mitigation plan, so that there's no impacts off site from the development process. We have received, we had a meeting last week with planning and zoning officials, CDPHE officials. Their communication with us has indicated that there are no current sources of contamination known on the property. All of those had been remediated through other activities back in the 1990s. But should they, as they intrude upon this property and start digging around, if they do come up and find anything that's suspicious or visible or sensed by the nose, the taste, the mouth, whatever, they have to do additional analysis and whatever cleanup is required in order to remediate to protect public health. So we've received a number of inquiries and complaints and questions from the public as a result of our meeting last week with planning and zoning and CDPHE. We've crafted a few general responses to those inquiries that we've received. We'll be using those general responses for any further inquiries that we receive from the community. And then if there are more specific questions, we may be referring a number of them to CDPHE or EPA, who were involved with the remediation of contamination issues on that site. So I wanted to just reconnect with you because you had heard from the community. We are aware of it. The grading permit has not been issued yet, but is in the works to move the canal. There has been no development plan that I'm aware of approved. I'm not even sure if it's been submitted yet for the remainder of the development that's planned for that property. But that'll be another process of review on the part of planning and zoning, of which we are a referral agency. And so we will have the opportunity to make further recommendations to planning and zoning in terms of conditions, specific conditions on any land use permit that comes before them. So hopefully that gives you a kind of an overview of what's going on there. If you receive questions or concerns, please direct them our way. We're happy to answer those questions. And or if you have specific questions yourselves, please reach out to me. I'm happy to work to get you the answers you need.
Thank you. Any questions or comments for Jim?
No, just thank you, Jim. I do appreciate that. I know
I
it's
do
hard. I know it's hard to hear comments in public, and then we sort of are all dormant, like we don't care, we're not doing anything. But I do appreciate the follow-up.
Great. And we will have one staff member who has a proposal for the board during staff updates. Thank you very much.
Thank you. Hey, Gwen, Interim Director for Clinic Services. Are you with us? There you are.
I am. Good evening. I don't have any updates for this evening, unless you all have any questions for me.
We just want to give you a chance if you have any.
Thank you so much.
And Christine.
Good morning, everyone. Thank you so much for allowing me some space this evening. Have a few updates for you. The first and probably the star shining moment for our division is that we are the host of the November Employee of the Month. So Jen, if you have your camera on, I'd love to brag about you at the moment if you're on. Jen Verdon is the Administrative Services Coordinator, Senior Coordinator for the Emergency Preparedness and Infectious Disease Division. She is a new to public health professional and has taken it upon herself to rapidly learn about the basic tenets of public health through a thorough review of the 10 essential functions, the public health accreditation standards, the public health preparedness capabilities, and numerous literature reviews. The hard work that Jen puts into this speaks to how she approaches her work at JCPH, not just doing the job, but understanding the why of the work that we are doing. Jen has truly worked hard to find her public health why. Her coworkers shared that Jen is willing to jump in feet first, learn something new, and tackle any project handed to her, which can be illustrated by the fact that within 5 months of being hired, Jen had completely overhauled our program services book. So if the board has not seen that yet, please make sure that you have a chance to take a look at that. That provides a reference for all new staff and even current staff on the programs and important work that JCPH is doing. She also used this knowledge attained in that project to really coordinate the update of our budget book pages that go to the county that are shared with the county commissioners and are available to all of our Jefferson County residents. So huge thanks to Jen for all of that work. The team reports, and I can certainly agree, that she has a great attitude and a willingness to help. She can always be counted on to complete tasks in a timely and accurate manner, and she applies critical thinking skills, multitasking, project prioritization, and teamwork to ensure that the work of the whole team is supported thoroughly and thoughtfully. Jen is always quick to learn new skills, is willing to do whatever it takes, including learning a whole slew of new acronyms, if you are familiar with all of our preparedness work, and is willing to help anyone, no matter where they are within JCPH. She will offer a helping hand across all divisions and carries about her an infectious, in a good way, positive attitude. She has a wicked sense of humor and brings so much positivity to team meetings. So Jen Verdon, thank you so much and congratulations on being our November Employee of the Month.
Congratulations, Jen. And welcome.
Also welcome.
Yeah, and welcome. You jumped
Thank
right
you so
in.
much.
You jumped
I
right
love
in.
working here, so thank you.
Well, we're glad you're here.
A few other updates from me. Hopefully the board has been tracking the news. We have seen a very large surge in pediatric hospitalizations for RSV, the respiratory syncytial virus. Across the metro area, so that north central region that you've heard me talk about before, is it related to COVID data? We actually have 0 pediatric ICU beds available. 0. They are training additional staff in pediatric capabilities because not everyone comes into a healthcare profession with the ability to care for our youngest patients. And so we are cross-training staff. The state health department has been holding 3 times a week calls in partnership with our healthcare coalition to work on movement of patients across the state for space for these pediatric patients in different hospital settings. So the Colorado Hospital Transfer Center is what it's called. It is up and running. There have also been executive orders that have been issued to try to allow for additional staffing capabilities to care for these young patients within the hospital settings. Anjanette reported back to me, our EPR coordinator, that hospitals in regard to supply chain are seeing concerns related to epinephrine, which is actually an ongoing concern even among our EMS partners coming out of COVID response, as well as amoxicillin and potentially albuterol. So if you know anything about care for respiratory illnesses, we are monitoring this very closely. If our hospitals have a need, that request will come through us and we'll immediately funnel it up to the state health department. We haven't heard anything yet, but be aware that that potentially may happen. We are also tracking another set of executive orders related to third-party insurance. So getting creative about where we can house these patients as well. So that's the update on respiratory viruses. Seeing a slight uptick in flu, but it's not tracking as steep of a climb as our RSV cases are. And then in terms of new staff, I'd like to give a warm welcome to Amanda Havens. Amanda joins our Epi and planning team as the new health planner for the department. So she will be responsible for our community health improvement plan once our community health assessment is complete. The team has closed the data collection window, and so they are in the process of doing all the Epi work related to the data that was obtained, both qualitative and quantitative for the community health assessment. So more to come on that, but that is also additional work that is going on within our team. That's all I have.
Thank you. Thank you. Any questions, comments? Okay. Let's move into staff comments. I know that we have Mary Sloan. I think you wanted to make a comment, and other staff members can jump in also. I just had written down these two, and then Tashiana, I was just told, wanted to make a comment. Mary, are you there? There you are.
Hello, everybody. I'm Mary Sloan with the Environmental Health Division. I do the case management for the on-site wastewater variance cases. I haven't got the pleasure to meet a lot of the new board members, but I did want to extend a proposal of doing a training session with the board members discussing, you know, what are the on-site wastewater variance cases and the system components when it comes to an on-site wastewater system, and just kind of reviewing some of the basics of the regulations, and then discussing your role as a board member in deciding these variances of whether or not they should be approved. This would be an unofficial, you know, session, so it'd be just up to your individual schedules, and also up to, you know, if you think this would be beneficial for each of you. So you're more than welcome to, you know, hold off and think about it and give Lindsay a decision at a later date, or we can, you know, do some proposed times in January. I could send out some scheduled dates, but I just wanted to extend that invitation.
Mary, I think that that is a great idea. I think one of the best ways for us to do it is to have Lindsay's always the go-between, just so you know. She is our go-to. Have her coordinate with you and through her, the two of you. And then I think that's a great idea. And then we can put some dates out to the board members that do want to take that. And then I think that would be very beneficial, because it is very confusing when you're a new board member. Very confusing.
Yes, definitely. And then some of the items I had on the agenda, I don't know if you could see the right screen or not. It doesn't appear as though. Let's see. That should be right. So some of the agenda items are just very basic. So if you have any particular questions that you would like to forward over from Lindsay that you would like to discuss during this education session, I am happy to go over anything when it comes to this education session. So just think about, you know, when it comes to hardship, maybe we could define that a little bit clearer, because I know our regulations are kind of vague when it comes to hardship. But my ultimate goal is maybe to reduce the presentation time with our various cases, because as you know, Sherry, in our previous cases, it's been 3-4 hours sometimes. So
we've all experienced those, right, team?
Yes.
So if I could
Thank
just
you.
say, I think it's a wonderful idea.
Yeah, it is.
As the newest board member that has been through this process, but without this kind of a training, why, Hilda, we need this. And our new board member will as well. So this is a great idea. Thank you so much for recommending it, Mary.
Of course. Of course.
Thank you.
So I guess to be continued. I look forward to meeting with you guys. Thank you for your time.
Thank you. And Tashiana, I saw you a minute ago. There
Hi.
you are.
Thanks for having me. Yeah, since I've been attending the senior leadership meetings, I just thought it'd be easiest for me to gather the updates for family services. Thank you, Jody, for the update on the hiring. We look forward to the new director starting at the beginning of the new year. I just have a few small updates. The first thing is the Human Services Collaboration Program should be back up and running again pretty soon. The contract's currently at the county attorney's office. That's an interagency agreement between Jeffco Human Services and JCPH. So the program will provide short-term care coordination, nursing support, and working with the Division of Children, Youth, and Family. So it's a great way for nurses to be able to provide health history assessments, referrals, resources, health education, and psychosocial support to families. So I know more will be coming on that once the contract is ready to go, but just wanted to let you know that that one is getting close. The other thing that is being worked on currently is Kelsey Rivera and Allison Wilson, who are both part of Family Services, are meeting with HR and facilities to ensure that all Jeffco government buildings have lactation-friendly spaces, to allow us to designate all of Jefferson County as a lactation-friendly employer before the month of June. So JCPH is already designated, and we want to be able to extend that out to all of our Jefferson County buildings. And the last thing is just introducing 2 new staff. So the WIC team has 2 new staff who are helping to support some of the statewide WIC support that our team is providing. So we have Alyssa Williams and Candelia Leon. They both joined the team last month, and we're really happy to have them.
Well, thank you and welcome to the new members of your team. Any comments or questions? Thank you, Tatiana.
Thank you so much.
Okay. Are there any other comments from staff members? I don't want to leave anyone out. Okay, let's move into the Board of Health comments. Who would like to go first?
I guess I can go. I know at the beginning of the meeting today, it was a request to write a letter for the support of the climate action plan. I just want to bring it up and see if it's anything that we are interested in doing, or if we're going to follow up on that request.
So I would certainly support doing that as the board member who was on the, I think we were called the steering committee for that process. And I learned a heck of a lot from the meetings that I attended, all of them virtual, but still it was a very well organized process with some great information. And I would love to have us do a formal recommendation to the commissioners to approve the plan.
Other comments? I think it's a very, well worth doing. Certainly worth doing to do something like that. What is the deadline on that? It was like very, very soon.
I would think we would need to have it before the December 20th meeting where it is proposed to the commissioners, and potentially they are getting a briefing on it. I can't remember the date. I think the 6th. So it would be, I think, best if we had it to them before the 6th.
Mm-hmm. And who has to write a letter?
That's a good question. Lindsay, do you have ideas? Lane, do you have ideas?
Well, I was going to suggest Harriet, since she's been
I was
most
too.
involved, and I haven't had a
too.
chance to look through it. So I do already snapped up the URL. So I definitely want to also provide some comments. But as far as a general letter of support, I'm definitely down for that. But I wouldn't mind seeing whatever letter you draft. If you're
think
willing,
that's-
if you're willing to
that's-
do that, Harriet.
I could draft one and then we could send it around. It won't
Send it
be
to
very
Lindsay.
detailed, but yeah.
Yeah, you would send it to Lindsay and then she can get it to all of
Yeah.
us.
Yeah.
Thank you,
Might I
Harriet, for
Might
doing
I
that.
suggest that if you have any specific requests around how to encourage the Board of County Commissioners to not only look for resources or for providing resources to address the mitigation end, but additional resources to support any efforts to ensure that the implementation is done in an equitable manner and that community engagement in developing the implementation strategies is really digs deep into the community and really gets a lot of input from those disproportionately impacted communities in Jefferson County.
Yeah.
So Jim, would you do an email to me summarizing what you just said?
Sure.
And then I will do my best to incorporate that into the draft that I do, and then other folks can add more things.
Perfect.
Be happy to.
Any other comments, additions, questions?
That was just going to be my suggestion. If there's any other staff that have been engaged in that process, I was going to say if they want to just send in an email to add to that letter, just for consideration at least, I think that'd be helpful.
Yeah, that'd be great.
That'd
Love
be
it.
helpful.
Thank you,
Perfect.
Harriet, for taking that.
Yeah, thank you. Not that we didn't just vote you in, but
We kind of chose you.
That's what I get for coming back from vacation. Yeah.
that's right. You called it. Okay. Any more comments from the board members? And thank you, Hilda, for that. Harriet, do you have anything? Lane?
I'm glad to be back. And I'm glad I didn't fall asleep since I'm still operating on UK time.
Yeah.
Nothing
As
from
always.
me. I just, again, appreciate the information that was shared. This was a very, while we've been, I think, efficient in our time, there was a lot of good information from programs that was shared that I appreciated.
I would agree. And as always, I want to thank all of the staff because you are in it, in the trenches, day in and day out, and doing really, really good work. And so we're very proud of our JCPH staff. Oh, and then the one other thing I will say is we're not going to skip anyone for the Employee of the Month luncheon, because you know those are pretty hot items now. Everybody's loving going to those, right, Jim? And
Especially Jody.
Yeah, Jody, you missed the last one, but since we're not probably going to meet, which we voted not to meet in December, so we'll do November, December, and then we'll put them right into the January. So everybody will get to still go. Okay. Is there any other comments that anybody wants to make before we adjourn? Okay. Seeing none, we will adjourn this meeting at 5:45.
Happy Thanksgiving, everyone.
Thank you.
Have a great
Happy
evening.
Bye,
Thanksgiving.
everybody.
Thanksgiving all.